So when people have pain arising from spinal conditions like uh, an acute sciatica or arm pain or neck pain from degenerative conditions like disc disease or nerve entrapment, then sometimes we can mm, treat these patients with an operation, which is basically we open up the spine and take out the offending bit and free up the nerve. That usually relieves the pain. So this is the commonest form of spinal surgery that we do. There are other kinds of spinal surgery which are much more complex, like trauma, tumors, reconstruction, deformities. But basically, it is about decompressing a nerve inside the spine. So spinal surgery in modern times is very, very safe surgery. We do a vast number of spinal surgeries with a very little risk or complication involved. However, any surgery comes with a small risk. The common things that we see are wound infections, fluid leaking from the wound, um, and then chronic pain. Sometimes, and this is very, very rare, that we get significant neurological problems like loss of function, for example, a hand or the foot to drop, or nerve damages leading to difficulty with waterworks, and extremely rarely and exceedingly rarely uh, catastrophic complications like paralysis, etc. So usually the stay for most of the common spinal surgeries is 1 to 2 days in the hospital, and then a period of recovery at home. Uh, Invariably, patients are mobile after the procedure, so they don't have to rest. A full recovery ranges between 4 weeks to 3 months, depending on the severity and the complexity of an operation. Spinal conditions are quite complex. They are quite varied. The presentation is also very, there's a huge spectrum of conditions and presentation from spinal conditions. Majority of the time, these can be treated with conservative management, like exercise, physiotherapy, painkillers, visiting a chiropractor or osteopaths, um, and time. In a small subset of patients, when the condition doesn't resolve, there can be an indication for an operation. Now, most of the time, you would require an MRI, which is the workhorse. It is the most important imaging that we do in spine. If that shows then an obvious surgical cause for your pain and the conservative treatment has failed, then you would benefit from surgical intervention.